Hi guys, it's KayKittles here, and my real name is Keisha, and I have 12 years experience working as a dermatology clinical technician in New York City. And during my time working as a clinical technician, I've seen all kinds of different skin disorders and all kinds of different basically hair damage from the metabolic level as well as hair breakage from processing, over processing, and chemical treatment. Pretty much what we did is basically try to treat the patient the best that we can. 50% of the patients were pretty much there for metabolic reasons, which means that it came from the cellular level, meaning that they had like thyroid problems, diabetes, or any kind of endocrine problem, or basically they were systemic. And basically what we did with those patients were give them injections of steroids to the localized area, which was basically that was called alopecia, alopecia areata if it was just one localized area, or if it was all over where they had big blotches of alopecia. Basically they were had to be treated with a wig, or we gave them ultraviolet light or some kind of a medication, or they can get treated with minoxidil, which is like Rogaine or something like that. But in the long run, the results of that coming back was very, very low. The other 50% of the patients that had hair loss was mainly from breakage, which is really not hair loss. It's mainly breakage from heat damage, so that wasn't always from the root. It was really just breaking off at the ends, which is from overprocessing, relaxing, chemical treatments, heat damage, things that was induced by the patient. And what we tried to do with those patients was basically educate them and tell them the right way to take care of their hair. But if you were basically raised by someone, or you basically didn't know any better for years on how to take care of your hair, it's pretty hard to just come in all of a sudden after 20-30 years of taking care of your hair and doing a certain regimen, and someone tells you, you have to stop relaxing your hair and stop curling your hair, and you have to stop putting chemicals to your hair, and the oils that you're using is not natural for your hair. It's very, very difficult to explain to someone that what they're using in their hair is actually killing, even though your hair is dead already, but it's actually, not preserving the hair. So with those patients, we basically had a hard time. So we would give them like a handout on what is best for their hair. And in the handout basically was to tell the patient to drink more water, try and take a multivitamin, which was a little bit higher in biotin, iron, and basically and try and get exercise and eat better. But then we would get the patients come back to us a month later, and they would come back with conditioners of vitamin B conditioners and biotin, treatments of, this and that. And we were like, okay, listen to us. We're telling you that you need to take it on the inside for it to come out on the outside. So this is what I'm trying to explain to you. It's never a quick fix. Your hair is only going to grow a 1/4 inch to a 1/2 inch per month. It's a very long journey to get hair growth. Look at me. I did my big chop probably about a month and a half ago, and I know that it's going to be a long journey for me. So I have to be patient too. And I'm basically going through the same motions, and I was miseducated all my life. I'm in my 30s, and I have to just go through everything and unravel everything that I was trained as far as the petrolatum and the mineral oils and just all the grease and everything that people have trained me, and I'm basically telling my mom, no, I can't use this in my hair. It's no good because it will dry my hair out. She's like, how can oil dry your hair out? But it's just, society has trained us to believe that these things will moisturize your hair, but in reality, it's not moisturizing your hair. So these are the cycles of hair growth. Like I said, your hair grows about a 1/4 inch to a 1/2 inch, or it could grow a little faster depending on heredity and your family genes. Now there's 4 growing phases. One is anagen, which that's the growing phase, and that can last 4 to 7 years, and it could last a little bit longer. And that all depends on your family genes. Now, if you look in your family genes, you see all the women in your family have great long hair, or even the men have great long hair. You know what I mean? So you just pay attention to that all the men have nice thick hairlines, or you don't see anybody receding hairlines, because you have to pay attention to that too, because just because all the men could have receding hairline, you are a woman, you have to pay attention to that too, because that can cause hair thinning to you, because you can follow the men's pattern. Now there's catagen. I hope I'm saying that right. And that's the resting phase. Now that can last anywhere between 1 to 2 years, unfortunately, and that's when basically the hair is at rest. So you don't know when your hair is in that phase, so you basically have to take care of your hair and moisturize it, seal the ends, make sure that your hair is not rubbing on your shoulders or being pulled or tugged by your purse or anything like that, so that you are protecting it and not ripping it back out. So all these things are necessary, because you don't want to have to be in that phase and then you're like, oh my god, my hair is not growing back fast enough, or I have one side longer than another, and you're going to end up with problems. Then the next one is telogen, which is the shedding phase. Then you end up with the hair starting to shed, but you'll know when you're in the telogen phase because the hair will shed at the root. You're going to see the little white bulb at the end. If you don't see the white bulb at the end, that means that your hair is breaking. So there's a difference between shedding and breaking. And the last phase is exogen, which when the follicle dies, and that's when you have like a nice long hair, and it usually has like a little, it's very like tethered at the end. And usually about 80% of our hair enters into that phase. Not 100% of our hair ever, dies at one time, but 80% of our hair will go into that phase, and then and then another hair will come out of a follicle. So this is the 4 stages of the hair. Okay, not all the time will all your hair go through that. It's like this hair will be in one stage, that hair will be in one stage. So it's not like, every hair together is going to be going through it. So it's like random around the head. So don't worry, like, oh my god, every hair on my head right now is in exogen. So please just relax, don't move. It's all going to fall out right away. So just relax. It's not going to be that way. It happens randomly. You can have like just one spot over here, one spot over there. But there are some cases, just like the patients that came with the alopecia, that they will have one clump over here in the exogen phase where the follicles just fell out together. So you don't want to be in that phase. Also, if you want to learn more in detail about hair, and especially black hair, please go for The Science of Black Hair. This is a great book. It's by Audrey Davis Savinsky. Oh my god, I really butchered her name. Awesome book. I've read this book and I'm gonna go through it again. I got so much information, so much things about black hair that I did not know, and how to take care of my hair. It also teaches you how to do a regimen on yourself, something good for your own hair. And I really love this book. I recommend it, and I think you should all look into it. Once again, it's KayKittles here, and thanks for watching. Rate, subscribe, comment. If you need to get in touch with me, if you have any questions, my Gmail account is kaykittles@gmail.com. Okay, bye.